November 20th, 2025. The sun had just begun to filter through the kitchen window, casting a gentle glow over the start of another ordinary day. David, a retired schoolteacher, started his day as usual. Coffee, newspaper, quiet routine. The familiar rustle of the paper, and the rich aroma of his morning brew, were small comforts, part of a ritual he cherished since leaving the classroom behind. As he reached for the paper, a strange tingling ran down his left arm. It was subtle at first, almost like his arm had simply fallen asleep. He shrugged it off, thinking it was nothing more than a fleeting ache. He tried to sip his coffee, but his lips felt numb. The cup slipped, coffee dribbled down his chin. He frowned, puzzled by the sudden clumsiness, and dabbed at the spill with a napkin, still not fully aware of what was happening. Suddenly, his left hand went limp. The newspaper fell to the floor, pages fluttering as if in slow motion. David stared at his hand, willing it to move, but it remained stubbornly unresponsive. Dizziness hit him hard. The kitchen spun. He gripped the counter for support, his knuckles whitening. The world seemed to tilt, and a wave of nausea washed over him, making it difficult to focus. Confusion clouded his mind. He couldn't make sense of what was happening. Thoughts that once came easily now felt tangled and distant, as if he were trying to recall a dream slipping away. Sarah, his wife, entered the kitchen. "David, are you all right?" Her voice was gentle but edged with worry, sensing something was wrong before she even saw his face. He tried to answer, but only slurred, garbled sounds came out. The words in his mind refused to form on his lips, and frustration flickered in his eyes. Panic set in. He looked at Sarah, trying to smile, but only half his mouth moved. The other side drooped, betraying the gravity of the moment. Sarah's face turned from concern to alarm. She recognized the signs instantly, her heart pounding as she recalled what she'd learned about strokes. Drooping face, weak arm, slurred speech. She'd seen this on TV. The checklist ran through her mind: fast, face, arms, speech, time. She knew time was critical. Without hesitation, she grabbed her phone and dialed emergency services, her hands trembling but her mind focused on saving her husband. In that moment, her quick action became David's best hope. Every second counted, and she refused to let panic paralyze her. A peaceful morning shattered by a silent emergency. Every second now mattered. In the quiet kitchen, the urgency of the moment echoed louder than any alarm, reminding us all how quickly life can change, and how vital it is to recognize the signs and act without delay. David was having a stroke, a brain attack. In a matter of moments, his life changed dramatically. A stroke is a sudden interruption of blood flow to the brain, and it can strike anyone, at any time, regardless of age or health. It's a medical emergency that demands immediate attention. Like a heart attack, but in the brain. While a heart attack affects the heart's ability to pump blood, a stroke disrupts the brain's ability to function. The brain, our body's command center, is suddenly cut off from the vital blood supply it needs to survive. The brain needs constant blood flow for oxygen and nutrients. Every second, billions of brain cells rely on this steady stream to think, move, feel, and remember. Without it, the brain's delicate tissues begin to suffer almost instantly. When that flow stops, brain cells die within minutes. The damage can start in as little as 5 minutes, and the longer the brain is deprived, the more severe and widespread the injury becomes. That's why time is everything in a stroke. Every tick of the clock means more brain cells lost, and less chance of a full recovery. Immediate action can mean the difference between life and death, or between recovery and lifelong disability. The damage depends on which part of the brain is affected and how long it's deprived of blood. Some strokes affect movement, others, speech, vision, or memory. The symptoms and consequences can be vastly different from person to person. Imagine a city losing its water supply, chaos, shutdown, basic functions lost. Just as a city can't run without water, the brain can't function without blood. Everything grinds to a halt, and the effects ripple outward. That's what happens in the brain during a stroke. A blockage or a burst vessel cuts off the supply, and the affected brain region begins to shut down, sometimes permanently. The affected area can't do its job, move muscles, process language, or store memories. Everyday abilities we take for granted can vanish in an instant, leaving lasting challenges. If blood flow isn't restored quickly, the damage can be permanent or fatal. Families are left waiting, hoping for good news, while doctors race against time to save as much brain as possible. Recognizing the signs and acting fast is life-saving. sudden weakness, trouble speaking, facial drooping. These are all red flags. Call emergency services immediately if you notice them. Stroke is a true emergency. Waiting it out is the worst mistake. Every minute counts, and delays can mean the difference between recovery and irreversible loss. Every second, millions of brain cells are lost. The faster treatment begins, the more brain can be saved, and the better the outcome. Public awareness campaigns stress immediate action for a reason. They teach us to recognize the warning signs and to never ignore them. Knowing what a stroke is, and the urgency, can save your life or someone else's. Education and quick response are our best weapons against the silent killer. Time lost is brain lost. When it comes to stroke, every moment matters, so act fast, and you could save a life. Not all strokes are the same. In fact, understanding the differences between stroke types is crucial for both patients and medical professionals. Strokes are a leading cause of disability and death worldwide, but the way they happen, and how they're treated, can be very different. There are two main types of stroke: ischemic and hemorrhagic. Each type has its own causes, symptoms, and treatment approaches, making it vital to distinguish between them quickly. Ischemic strokes are by far the most common, accounting for about 87% of all cases. They occur when a blood vessel supplying the brain becomes blocked, usually by a blood clot. This blockage cuts off the flow of oxygen-rich blood to parts of the brain, causing brain cells to begin dying within minutes. There are two main ways this can happen. In a thrombotic stroke, a clot forms right inside one of the arteries of the brain, often due to a buildup of fatty deposits called plaques. In an embolic stroke, the clot forms elsewhere, often in the heart, and then travels through the bloodstream until it lodges in a brain artery, blocking blood flow. The result is the same. Brain tissue beyond the blockage is starved of blood and oxygen, leading to rapid cell death. This is why time is so critical in treating ischemic strokes. Every minute counts. Hemorrhagic strokes, on the other hand, are less common but often more severe and deadly. They make up about 13% of all strokes, but are responsible for a much higher percentage of stroke-related deaths. In a hemorrhagic stroke, a blood vessel in the brain ruptures or bursts, causing blood to leak into or around the brain tissue. This sudden bleeding can happen for several reasons, including chronic high blood pressure or a weakened blood vessel wall. The leaked blood puts intense pressure on surrounding brain cells, damaging them and disrupting normal brain function. This pressure can quickly become life-threatening. At the same time, the bleeding deprives other areas of the brain of the blood they need to survive. High blood pressure is a major risk factor for this type of stroke. Another common cause is an aneurysm, a weak spot in a blood vessel wall that balloons out and can burst under pressure, leading to a hemorrhagic stroke. While hemorrhagic strokes account for fewer cases overall, they are responsible for a disproportionate number of deaths and severe disabilities, making them especially dangerous. The difference between these two types of stroke is critical because the treatments are completely different. For an ischemic stroke, doctors may use clot-busting drugs or procedures to restore blood flow. For a hemorrhagic stroke, stopping the bleeding and relieving pressure on the brain is the priority. That's why a quick and accurate diagnosis is essential. Doctors rely on brain scans and other tests to determine the type of stroke and start the right treatment as fast as possible. In stroke care, knowing the cause is everything. The right treatment at the right time can save brain cells, preserve function, and give patients the best chance at recovery. When it comes to stroke, every second truly matters. Recognizing the signs, understanding the differences, and acting fast can mean the difference between life, death, and lasting disability. Sometimes, the body gives a warning, a transient ischemic attack or TIA, often called a mini-stroke. Symptoms are identical to a stroke: sudden numbness, confusion, vision trouble, dizziness. The difference? TIA symptoms disappear within minutes to an hour. Many ignore it, but that's a dangerous mistake. A TIA is a red alert. A major stroke could be imminent. About 1/3 of people with a TIA will have a major stroke within a year, many within days. The cause is the same: a temporary clot. If you or someone you know has stroke-like symptoms, even if they vanish, treat it as an emergency. Get medical help immediately. It's a second chance. Don't waste it. A TIA is a warning you can't afford to ignore. In an emergency, remembering every symptom is tough. That's why we use the acronym FASTF is for face drooping. Ask the person to smile. Is one side uneven? A is for arm weakness. Can they raise both arms, or does one drift down? S is for speech difficulty. Ask them to repeat a simple sentence. Is it slurred or strange? T is for time to call emergency services. Don't wait. If you see any of these signs, act immediately. Quick action can save a life. FAST is your tool. Use it. Seconds count. Stroke risk isn't random. It's shaped by health and lifestyle. High blood pressure is the top risk, often silent, always dangerous. Heart issues like atrial fibrillation, high cholesterol, and diabetes all raise your risk. Smoking, poor diet, inactivity, and heavy drinking make things worse. Some risks, age, family history, ethnicity, can't be changed, but most can. Managing blood pressure, eating well, staying active, and quitting smoking make a huge difference. Know your risks. Control what you can. Prevention starts with you. Don't wait for a warning sign. At the hospital, stroke care is a race against time. The team acts fast. Vital signs, neurological exam, and a CT scan to see if it's a clot or a bleed. The scan guides treatment. Giving a clot buster to someone with a bleed would be disastrous. Blood tests and medical history help pinpoint when symptoms started. Every minute matters for eligibility and outcome. Stroke care is high-speed teamwork, all focused on saving brain cells. The right diagnosis, fast, is everything. Time is brain. Once the stroke type is clear, treatment begins. For ischemic strokes, the goal is to restore blood flow, often with TPA, a clot-busting drug, if given within hours. Some patients need a mechanical thrombectomy. A doctor removes the clot directly. For hemorrhagic strokes, the focus is stopping the bleeding and relieving pressure, sometimes with surgery. Blood pressure is managed aggressively. Patients are monitored in specialized stroke units. The right treatment, delivered fast, can save lives and limit disability. Recovery starts here. Every second counts. Recovery begins once the patient is stable. Rehabilitation is tailored, physical, occupational, and speech therapy helps survivors regain lost skills. Physical therapy rebuilds movement and strength. Occupational therapy restores daily living skills. Speech therapy tackles communication and swallowing problems. Emotional support is vital. Stroke recovery is a team effort. Every small victory matters. With determination and support, life after stroke is possible.